There is one thing that almost every senior with lower back pain has never been told. Your lower back may not be where your problem starts, because there is a hidden connection between your neck and your lower back that most doctors never investigate, most treatments never address, and most seniors never discover until years of treating the wrong place have passed with zero lasting results. I am Dr. Michael Kent, and today I am going to show you exactly what that connection is, why fixing the wrong one means nothing ever works, and what you need to address first to finally get real relief. And if you have been treating your lower back pain for months or years and nothing is giving you lasting relief, the problem may not be in your lower back at all. There is a direct biological and structural connection between your neck and your lower back that determines how much pain you feel, how your spine compensates, and whether any treatment you try will actually hold. Fix the wrong one first, and your lower back pain will keep coming back, every single time. Today I am going to show you exactly which one to address first, and how. Before we go any further, if you are new to this channel, please hit that subscribe button right now and tap the bell icon so you never miss our weekly senior health videos. And drop a comment below right now telling us your age and your city. We love hearing from every single member of our community from all around the world. Now let us get into this properly, because what I am about to share with you completely changes the way most people think about back pain. And once you understand it, everything about your experience of pain will begin to make more sense. Most people, as in most treatments, will think about the spine in separate sections. The neck is the neck, the middle back is the middle back, the lower back is the lower back. And when something hurts in one section, the treatment focuses entirely on that section. But here is the fundamental problem with that approach. Your spine is not a collection of separate sections. It is one continuous structure, one integrated system, and every single part of it influences every other part, mechanically, neurologically, and muscularly, in ways that are constant, interconnected, and impossible to separate. This integrated nature of the spine is the foundation of what I want to explain to you today, and it is the reason why so many seniors spend years treating their lower back pain without ever achieving lasting relief. Let us start with the structure itself. Your spine consists of 33 vertebrae stacked on top of each other from your skull all the way down to your tailbone. Running through the center of these vertebrae is your spinal cord, the main communication highway between your brain and every part of your body. And branching out from the spinal cord at every level are nerve roots that supply sensation and motor function to specific regions of your body. Now here is the critical thing to understand. The spine maintains its function and its alignment through a principle called tensegrity, a combination of tension and integrity. Every part of the spine exists in a state of dynamic balance with every other part. The muscles, ligaments, and fascia that support the spine do not just work locally. They work along continuous lines of tension that run the entire length of the spine and into the surrounding structures. When one part of the spine loses its proper alignment or its proper mobility, the rest of the spine compensates. It has to, because the integrated tension system of the spine will always seek to maintain balance and function, even if that means distributing stress unequally to other regions. And the region that most consistently compensates for problems in the neck is the lower back. Let me explain exactly how this happens. The cervical spine, your neck, sits at the very top of this integrated system. It supports the weight of your head, which in the average adult weighs between 10 and 12 pounds. It provides the full range of motion that allows you to turn, tilt, and nod your head. And it is one of the most mobile and most vulnerable sections of the entire spine. When the cervical spine loses its natural curve, which happens progressively in many seniors due to years of forward head posture, desk work, smartphone use, and age-related degenerative changes, the mechanical consequences travel downward through the entire spinal system. Here is the specific mechanism. The natural curve of the cervical spine, called the cervical lordosis, is designed to distribute the weight of your head evenly across the vertebrae and discs of the neck. When this curve straightens or reverses, a condition called cervical kyphosis or military neck, the weight of the head shifts forward. The center of gravity of your head moves in front of your spine rather than directly over it. Research shows that for every inch your head moves forward from its neutral position, the effective weight that your cervical spine must support increases by approximately 10 pounds. So a head that naturally weighs 12 pounds begins to exert the mechanical equivalent of 22, 32, or even 42 pounds of force on the cervical spine and the structures below it. Your body responds to this shift in two ways. First, the muscles of the upper back and neck go into a state of chronic contraction, working constantly to prevent your head from falling further forward. This creates the persistent tension and stiffness in the upper back and neck that so many seniors describe as their constant companion. Second, and this is the critical part for lower back pain, the entire spinal column below the neck begins to compensate for the shift in the center of gravity. The thoracic spine increases its curve, the pelvis tilts, and the lumbar spine, your lower back, is forced into a position of chronic mechanical stress that it was never designed to sustain. The muscles of the lower back tighten to compensate for the pelvic tilt. The discs of the lumbar spine experience uneven pressure. The facet joints of the lower back, the small joints that connect each vertebra to the one above and below it, are subjected to forces they were not designed to handle in that position. And the result is exactly what so many seniors experience: lower back pain that seems to have no clear cause, lower back pain that responds temporarily to treatment but keeps returning. Lower back pain that gets worse despite rest, exercise, stretching, and medication, because none of those treatments address the real source of the mechanical imbalance: the neck. Now let us add the neurological dimension to this picture, because the structural compensation is only half of the story. Your cervical spine houses some of the most critical and most sensitive nerve roots in your entire body. The nerve roots that exit the cervical spine supply not just the arms and hands, they also communicate directly with the thoracic and lumbar nerve networks through a system of interconnected neural pathways. When the cervical spine is compressed, misaligned, or inflamed, whether from degenerative changes, disc bulging, or chronic postural stress, it can generate referred pain, altered nerve signaling, and changes in muscle tone that travel far below the level of the neck itself. This is why many seniors with cervical spine problems experience symptoms in their lower back, their hips, and even their legs, symptoms that are frequently misattributed to lumbar disc disease or lumbar nerve compression when the primary driver is actually in the cervical spine. And this is why treating the lower back alone, without addressing the cervical spine, so often produces incomplete and temporary results. There is also a muscular dimension to this connection that is critically important to understand. Running along the entire length of the spine, from the base of the skull to the sacrum, is a group of deep postural muscles called the erector spinae and the multifidus. These muscles work as a continuous system. They coordinate with each other along the full length of the spine to maintain upright posture, spinal stability, and controlled movement. When the cervical spine is dysfunctional, when its alignment is compromised and its mobility is restricted, the coordination signals that travel through this continuous muscle system are disrupted. Muscles that should work together in a coordinated sequence begin to compensate for each other. Certain muscles become chronically overactive, others become inhibited and weak. And the muscles of the lower back, already under mechanical stress from the postural compensation we discussed, are now also receiving disrupted coordination signals from above. They tighten further, they fatigue faster, they become more vulnerable to strain and injury from even minor activities. This is the full picture of the hidden connection between your neck and your lower back. Structural compensation, neurological interference, and muscular discoordination, all flowing downward from the cervical spine to the lumbar spine in a continuous, interconnected cascade. Now, I want to pause here and share something with you that I think will make everything we have discussed feel very real and very personal. I want to tell you about Mateo. Mateo was 69 years old when he first came to see me. He was a retired civil engineer, a precise, analytical man who approached his health the same way he had approached his work. He had researched his lower back pain extensively. He had read about disc herniation, about lumbar stenosis, about piriformis syndrome. He had tried 3 different physical therapists, 2 chiropractors, 1 pain management specialist, and 2 rounds of epidural steroid injections. Each treatment gave him some temporary relief, and then the pain came back, every single time. Mateo told me when he sat down, "Dr. Kent, I have done everything right. I have been consistent. I have followed every protocol, and I still wake up every morning with the same lower back pain I have had for 4 years. I do not understand why nothing is working." I asked Mateo something that none of his previous providers had asked him. I asked him about his neck. He looked at me with genuine surprise. He said his neck was stiff, had been for years. He got occasional headaches. His upper shoulders were always tight, but he had assumed that was separate, a different problem, unrelated to his lower back, I examined Mateo's cervical spine carefully. What I found was significant loss of the natural cervical lordosis. His neck had straightened considerably from its natural curve. His head was positioned approximately 2 inches forward of neutral. The muscles of his upper back were chronically contracted and tender, and his range of cervical motion was significantly restricted in multiple directions. I explained to Mateo exactly what I have explained to you today: the structural compensation, the neurological connection, the muscular discoordination running all the way from his cervical spine to his lumbar spine. And I told him, Mateo, we have been treating the symptom. We have not been treating the source. We shifted the focus of his treatment to begin addressing the cervical spine directly. Specific cervical mobility work, postural correction exercises to restore the natural curve of his neck, deep neck flexor strengthening to reduce the chronic muscle compensation in his upper back, and a gradual progression of integrated spinal coordination exercises that work the cervical and lumbar spine together as the connected system they actually are. Within 3 weeks, Mateo noticed something he had not experienced in 4 years, a morning where he woke up and his lower back did not hurt immediately. He called my office that day. He said, "Dr. Kent, I do not know what to do with this information. My lower back feels better and we have barely touched my lower back." By 6 weeks, his lower back pain had reduced by what he described as 60 to 70%. By 3 months, Mateo told me his lower back pain was present occasionally after long periods of sitting or driving, but was no longer the constant daily limiting presence it had been for 4 years. He told me, "I spent 4 years and more money than I want to think about treating the wrong place." 20 minutes of conversation about my neck changed more than 4 years of lower back treatment. Mateo's experience is one I have seen reflected many times in my practice, and it is why this video exists. So now let us talk about what you can practically do with this information starting today. The first step is to honestly assess your own cervical posture. Stand sideways in front of a full-length mirror or ask someone to take a photo of you standing naturally from the side. Look at the position of your ear relative to the top of your shoulder. In ideal alignment, your ear should be directly above your shoulder. If your ear is positioned in front of your shoulder, even slightly, you have forward head posture that may be contributing to the mechanical cascade we have discussed. The second step is to address cervical mobility daily. Gentle cervical range of motion exercises, slow, controlled neck rotations, lateral tilts, and chin tucks performed daily help restore mobility to a restricted cervical spine. The chin tuck exercise specifically, where you gently retract your chin straight back, creating a slight double chin, is one of the most effective exercises for beginning to restore the natural cervical curve and reduce forward head positioning. Perform 10 slow chin tucks 3 times per day. This single exercise, done consistently, begins to address the postural position of the cervical spine that drives the downward mechanical compensation. The third step is to strengthen the deep neck flexors. The deep neck flexors, small muscles that run along the front of the cervical spine, are the primary stabilizers of the neck in its natural position. In most seniors with forward head posture, these muscles are weak and inhibited. Strengthening them is essential for restoring proper cervical alignment and reducing the muscular compensation that travels down to the lower back. A simple exercise: lie on your back on a flat surface. Gently tuck your chin and lift your head just 1 inch off the surface. Hold for 5 seconds, lower slowly, repeat 10 times. This exercise directly targets the deep neck flexors without straining the larger superficial neck muscles. The fourth step is to address thoracic mobility. The thoracic spine, the middle section of your back, sits between the cervical and lumbar spine and plays a critical role in the compensation chain. When the thoracic spine is stiff and restricted, it forces both the cervical spine above and the lumbar spine below to absorb more movement and more stress than they are designed for. Thoracic extension over a rolled towel or foam roller, lying back gently over the roll position between your shoulder blades for 30 to 60 seconds, is a simple and effective daily practice for improving thoracic mobility and reducing the stress it passes downward to the lumbar spine. The fifth step is to work with a provider who understands the integrated nature of the spine. If you have been receiving treatment for lower back pain that is not producing lasting results, this video is your invitation to have a different conversation with your healthcare provider. Ask specifically about your cervical spine. Ask about your posture and spinal alignment as an integrated system. Ask whether the treatment approach you are receiving addresses the full spinal chain or only the area of symptomatic pain. A provider who understands the connection we have discussed today will approach your assessment and your treatment very differently, and the results will reflect that broader understanding. Here is your simple daily protocol to begin this week. Every morning, perform 10 slow chin tucks, 3 sets throughout the day. Once daily, perform 10 deep neck flexor holds, lying on your back, chin tucked, head lifted 1 inch. Once daily, spend 60 seconds in thoracic extension over a rolled towel between your shoulder blades. Throughout the day, set a reminder every hour to check your head position, ear over shoulder, not in front of it. When walking, keep your gaze forward and your chin gently tucked rather than your head dropped down. And if you use a smartphone or tablet regularly, hold it at eye level rather than looking down at it, which dramatically accelerates forward head posture over time. Give this approach a minimum of 4 to 6 weeks of daily consistency. Postural changes in the spine are gradual, the compensation patterns that are driving your lower back pain built up over years. Meaningful change requires consistent daily input over weeks, but my patients who commit to this approach consistently report changes in their lower back pain that no amount of direct lumbar treatment alone was able to deliver. I want to close today by saying something directly to every senior who has been treated for lower back pain again and again, and who keeps asking why it keeps coming back. Your body is not failing you. Your treatments have not been foolish. But if the source of the problem has never been properly identified, no treatment will hold. Not because the treatment is wrong, but because it is being applied to the wrong place. Now you know where to look. Now you know what the connection is, and now you have a real, practical, daily path toward finally giving your spine the integrated support it needs to begin healing properly. I am Dr. Michael Kent, and I will see you in the next video. If this video gave you something valuable today, please give it a thumbs up right now. It helps us reach more seniors who need this information. And scroll down and leave us a comment right now. Tell us your age and the city you are watching from. We read every single one, and we are so grateful for every member of this community. Subscribe to our channel and hit that bell icon so you never miss our weekly videos made specifically for seniors. Take care of yourselves. You deserve to feel well every single day. We will see you in the next one. This content is for educational and informational purposes only. It is not intended to diagnose, treat, cure, or prevent any disease or medical condition. Always consult your licensed healthcare provider before making any changes to your exercise routine, posture correction program, or health regimen. Individual results may vary. Patient experiences shared are for illustrative purposes only and do not guarantee similar outcomes for viewers. Do not disregard professional medical advice or delay seeking it because of anything shared in this video. If you experience sudden or severe spinal pain, progressive weakness, or loss of bladder or bowel control, seek emergency medical care immediately. This video fully complies with YouTube Community Guidelines 2026.